Hello dear students. So in this session we'll deal with a quick review of joints. So introduction, joint is a part of the body where two or more bones meet which allows movement. So every bone in the body except for head bone meets up with at least one other bone at a joint. Classification. So the following four criteria will be taken into consideration to classify joints. So one is the structural, the most important and elaborate. Then functional classification, regional classification, and according to the number of bones articulating. So structural classification, you can see here fibrous joints, cartilaginous joints, and synovial joints. So if you observe this, the name itself speaks. The joint in which the two bones are connected by fibrous tissue is called a fibrous joint. A joint in which the two bones are connected by cartilaginous tissue, it's a cartilaginous joint. And a joint which is having a synovial joint cavity, so that will be a synovial joint. So structurally, fibrous joints, cartilaginous joints, and synovial joints. So fibrous joints are again classified into sutures, syndesmosis, and gomphosis. So sutures are again of different types. So one among them will be the plain suture. Example is median palatine suture. You can see the two bones are joined by a flat plain suture. The second type of sutures is serrate suture. You can see the joint where the two bones are meeting is like serrations. That's why it's called serrate suture. Example will be sagittal suture. Then squamous suture. So for example, it's the between parietal bone and squamous part of the temporal bone. So flat surface of one bone joins with the flat surface of other bone, forming a squamous suture. Then denticulate suture, you can see here, these are like tooth-like structures. That's why it's called as denticulate suture. Example is lambdoid suture. Then wedge and groove suture, otherwise called as shindellisis. Example, between the rostrum of sphenoid and the omer bone. So this is the omer bone, this is the rostrum of sphenoid. You can see the ridge of the rostrum of sphenoid is being received by the omer bone. Shindellisis or wedge and groove suture. Then the other type of fibrous joint is a syndesmosis. So in this, two bones are connected by interosseous ligament. Example are interosseous radioulnar and interosseous tibiofibular joints. You can see the tibia and fibula joined by the interosseous tibiofibular ligament. Then third type of fibrous joint is the gomphosis, also called as peg and socket joint. The root of tooth is fixed into the alveolar socket, okay, by periodontal ligament. So this is gomphosis. So structurally, the joints are classified into fibrous joints, cartilaginous joints, and synovial joints. The fibrous joints are classified into sutures, syndesmosis, and gomphosis. So the following are the types of sutures like plain suture, serrate suture, squamous suture, denticulate suture, and shindellisis. The other two types of fibrous joints are the syndesmosis and gomphosis. Cartilaginous joints, again classified into two types. Primary cartilaginous joints are synchondrosis. So two bones are connected by hyaline cartilage. These are temporary joints. It means with age they will be replaced by bone. Example, epiphyseal plate in long bones and first chondrosternal joint. Secondary cartilaginous joint, otherwise called symphysis. In this, the bones are covered by hyaline cartilage, and these hyaline cartilages are joined by a fibrocartilage. These joints are actually seen in the midline like symphysis, pubis, intervertebral discs, and manubriosternal joint. So you can see the primary cartilaginous joint. Example, epiphyseal plate of the growing bone, where epiphysis and diaphysis are being joined. This is the epiphyseal plate. It will be adding bone on both sides. So secondary cartilaginous joint, symphysis, pubis. You can see here, these are the two hyaline cartilage plates which are joined by a fibrocartilage. So then synovial joints. The synovial joints are the joints which are having a joint cavity. The characteristic features of synovial joints are presence of an articular cartilage, articular capsule, synovial membrane, synovial fluid which is secreted by the synovial membrane, articular disc or meniscus which divides the joint cavity into multiple compartments, and bursa are the synovial sacs lying between muscle and bone or tendon and bone to reduce the friction. Let us see here what are the features of articular cartilage. The articular surfaces are covered with hyaline cartilage in majority of the places. At certain places there might be fibrocartilage. So articular cartilage is avascular, non-nervous and elastic, and it is lubricated by synovial fluid. And the cartilage provides slippery surface for free movement. The surface of the cartilage shows fine undulations which is filled with synovial fluid. Then between the articular surfaces there is a joint cavity filled with synovial fluid. The cavity may be partially or completely subdivided by an articular disc or meniscus. Articular capsule. The joint is surrounded by an articular capsule which is made up of a fibrous capsule lined by synovial membrane. Because of its rich nerve supply, the fibrous capsule is sensitive to stretch imposed by the movements. So this sets up appropriate reflexes to protect the joint from any strain. So this is called the watchdog action of the capsule. The fibrous capsule is often reinforced by capsular or true ligaments representing thickenings of the fibrous capsule. Then the accessory ligaments which may be intra or extracapsular, distinct from fibrous capsule. Synovial membrane and synovial fluid. The synovial membrane lines whole of the interior of the joint except for the articular surfaces covered by hyaline cartilage. The membrane secretes a viscous fluid called synovial fluid, which lubricates the joint and nourishes the articular cartilage. The viscosity of the fluid is due to hyaluronic acid secreted by cells of synovial membrane. You can see here, these are the two ends of a bone. This is a typical synovial joint cavity. You can see this is the articular hyaline cartilage, and you can see this is the fibrous capsule or articular capsule, and you can see here this is the synovial membrane lining the entire joint cavity except the articular cartilage. So in this you can see these are the menisci in the knee joint. They divide the knee joint cavity into two compartments. You can see here this is the meniscofemoral compartment between the menisci and the femur bone. This is the meniscotibial compartment between the menisci and the tibia. So again this is the complete articular disc separating the joint cavity into upper part and lower part. So you can see here this is a bursa, suprapatellar bursa between the bone and the muscle. You can also see some adipose tissue within the joint cavity. Now going to the classification of synovial joints. So depending on the number of axes in which a synovial joint permits movement, the synovial joints are classified into uniaxial means the movement is around one axis, biaxial means the movement is around two axes, multiaxial means movement is in multiple axes, and plane or gliding. So there is only a slight gliding movement. So uniaxial joints are again classified into hinge joint. Examples are elbow joint, ankle joint and interphalangeal joints. So if we see in this hinge joint, there is only flexion and extension movement around the transverse axis. And if you see the next one, pivot joint, it's a median atlantoaxial joint and superior radioulnar joint. In this, there is rotatory movement around a vertical axis. So there is only one axis which is helping in the movement in this hinge and pivot variety. That's why they are uniaxial joints. Then biaxial joints. So again, two types, ellipsoid and condylar. Name itself speaks biaxial. That means there is movement in or around two axes. Example, the wrist joint and metacarpophalangeal joints. Then condylar joint, that is the knee joint, and the other one is temporomandibular joint. So condylar, so if you see this ellipsoid joint, the articular surfaces are ellipsoid in shape. And if you see the condylar, the articular surfaces are condyles. Like if you see in the knee joint, the condyles of the femur articulate with the condyles of the tibia to form a typical condylar knee joint. Temporomandibular joint, in this, the head of the mandible is like a condyle. Multiaxial joints, So typical is the ball and socket type, where you will see shoulder joint and hip joint are the classical examples of ball and socket joints. And saddle joint is the first carpo-metacarpal joint. The articular surfaces will be concavo-convex. The articular surfaces will be concavo-convex. I will show you in the figures next. Then plane or gliding joints. Examples are intercarpal and intertarsal. They allow only slight gliding movements. So you can see here, this is the elbow joint, humerus, between the humerus, radius and ulna. So there is only one axis, transverse axis, which will be passing through and through the medial epicondyle and lateral epicondyle of the humerus, and around that transverse axis there will be flexion and extension movement. You can see here, so this is the head of the radius. There will be a ligament here surrounding the head of the radius. So within the osteofibrous ring, the head will be rotating, forming a pivot joint around vertical axis. There will be rotation of the head of the radius, which helps in pronation and supination movements. So you can see this is a median atlantoaxial joint. So this is also an example for pivot joint. So this is an example for condylar joint, the condyles of the femur articulating the condyles of tibia. And you can see this is the temporomandibular joint. This is the head of the mandible or condylar process of the mandible. Now you can see this is the wrist joint, which is an example for ellipsoid joint. And you can see here this is the saddle joint, first carpo-metacarpal joint. So here you can see this is the ball and socket joint, hip joint between the head of the femur and acetabulum of the hip bone. Now, see, these are the three basic axes around which the movement occurs. You can see here AP, anterior-posterior axis. This is the anterior-posterior axis. This is the anterior-posterior axis. Okay. So, around which there occurs abduction and adduction. Abduction and adduction. Abduction is the movement away from the body. Adduction is movement towards the body. For this, the axis is anterior-posterior axis. And next, you can see this is the transverse axis, around which there will be flexion and extension, like flexing and extending the elbow. So then you can see the V here. This is the vertical axis around which there will be medial rotation and lateral rotation. So there are three basic axes around which the joint movements occurs: anterior-posterior axis, abduction, adduction; transverse axis, flexion, extension; and vertical axis will be rotation, medial rotation and lateral rotation. So till now we have seen the structural classification, which is very elaborate. Just to revise it: structural classification, fibrous, cartilaginous and synovial. In fibrous, sutures, syndesmosis, gomphosis. In cartilaginous, primary cartilaginous and secondary cartilaginous. In synovial joints, plane or gliding variety. Then uniaxial joints, where there is hinge and pivot types. Biaxial joints, where there is ellipsoid and condylar type. Then multiaxial, where there is ball and socket and saddle variety. Now functional classification. So function of a joint is movement. So depending on that, there are three types. Synarthrosis, there is no movement. Amphiarthrosis, there is slight movement. Diarthrosis, these are the typical synovial joints where there is complete movement or free movement. Next, regional classification: skull type, vertebral type, limb type. We use this very rarely. Then according to the number of bones articulating: simple joint where only two bones meet, compound joint where more than two bones meet, complex joint when the joint cavity is divided by menisci or articular disc. Like we have seen in the knee joint, there was a menisci dividing the joint cavity into meniscofemoral and meniscotibial. So simple, there is only articulation between two bones; compound, more than two bones; complex, where joint cavity is divided by articular disc or menisci. So movements of joints: angular movements, rotatory movements and circumduction. So angular movements, as I said, flexion, extension, abduction, adduction. The rotation is around vertical axis, medial rotation and lateral rotation. Circumduction is combination of all the movements: flexion, extension, abduction and adduction. So this circumduction movements will actually make the shape of a cone. The apex of the cone will be the joint, and the tip of the extremity which is making the circumduction will form the base of the cone. So factors limiting the range of movements: the bones itself, the articulating surface of the bones, then the ligaments which are holding the joint, the muscles around the joint, and the soft parts in relation to the joint. All these will limit the range of the movements. And the factors which maintain the stability of the joints, again same: bones, ligaments, and muscles. So the same factors which limit the movement, the same factors also maintains the stability of the movement. So Hilton's law, the most important, you have to remember. So you can give 10 stars for this. So suppose if we see, whenever we fall or whenever we slip, if there is any injury to the joint will be kept in most comfortable position. How it is being held in most comfortable position? Because the nerve which supplies the muscles acting at a given joint not only supplies the muscles but also innervates the joint and also the skin overlying the muscle. So whenever there is a joint injury, the muscles around the joint will go into spasm and the pain is conveyed to the skin. So that is why the muscles will try to remain in a most comfortable position in order to prevent the movement